All right, this is implementing shared decision-making into clinical practice, law and policy update. I'm Thaddeus Pope, and I'm going to talk about implementation. I'm glad to see that that's a big focus at this year's conference. For example, at tomorrow's keynote address, what's ready for prime time, and in the special issue of the EFQ. There's a lot of focus on recognition and endorsement of shared decision-making by professional societies and policymakers. So, for example, in the United States, a number of new professional associations have endorsed shared decision-making. And that's all very good. But if we focus more specifically on implementation and adoption, things are not so good. We see adjectives like seldom, incomplete, infrequent, stagnant, elusive, and rare. If you look at the opening editorial to the EFQ special issue, the authors say that there's a significant and sustained adoption problem. So focusing on recognition and endorsement of shared decision-making is important, but it's not sufficient. We need incentives. And so I'm going to focus on some incentives that we've deployed in the United States. So here's my roadmap for the next 8 minutes in 3 parts. What are legal incentives that can push shared decision-making uptake? Specifically, Medicare mandates, and how are those mandates working? So, legal tools to push shared decision-making. There are 3. First, there are liability tools. So, for example, in Washington State, the law provides a safe harbor legal immunity for using a certified patient decision aid. It's basically a shield, right? Second, there are mandate tools. These are a little bit different because it's not just an incentive, it's legally required. And those are described, those are pushed for example, in this article. And third, there are payment tools. These basically say that if you don't use a decision aid, then you don't get paid for providing that healthcare service. This is the most used type of incentive. So let's focus on those. Let's focus on payment tools. Our largest payer of healthcare in the United States is Medicare. It insures 50 million Americans. And not only is Medicare the largest, but when Medicare makes a move, other insurance companies follow. And what Medicare has been doing is requiring patient decision aids as a condition of payment. So we're going to give you 3 examples. First, in 2015, Medicare focused on lung cancer screening with low-dose CT scans. So this is for long-time smokers, and they get a lung cancer screening with a CT. But before they get the CT scan, the Medicare requires that they receive a shared decision-making visit, and that must be with 1 or more decision aids. The next year, Medicare focused on percutaneous left atrial appendage closure therapy. So the left atrial appendage is a source of blood clots, and we've typically treated that with medication, but now there's a device approach to the same problem. This Watchman device, can be implanted. But before implantation, there must be a formal shared decision-making interaction, and it must be with an evidence-based decision tool. And then in 2018, Medicare focused on implantable Cardioverter defibrillators, right, little device that shocks your heart back into function. And before implantation, there must be a formal shared decision-making encounter with an evidence-based decision tool. So we have these 3 shared decision-making patient decision aid mandates. low-dose CT scans, left atrial appendage closure therapy, and ICDs. How are they working? Well, in terms of ICDs, a study last year found that 43% of physicians reported using a decision aid, even though they're mandated. With respect to low-dose CT scans, remember that program started in 2015. And we basically have what you might say are three phases of published studies. First, in 2018, we had two early studies, these two, and what they found was the compliance rate with the mandate was 0%. Not a single clinician providing low-dose CT scans for lung cancer screening did shared decision-making or used a decision aid. Not one. In 2019, that got a little bit better, and the compliance rate was assessed at about 10%. And then this year, this study found that the compliance rate was 42%, provided shared decision-making. But if we look at that more closely, that shared decision-making was of a rather low quality. So only 23% of clinicians used a decision aid, even though it's required, and only 8% included all of the elements that are supposed to be part of that shared decision-making encounter. So what's the upshot? I just want to make 4 points. First, there's a big lack of compliance. Only 8 to 10% are following the low-dose CT scan mandate. 90% are not complying. Second, there's a lack of enforcement. Right? A lot of clinicians, most of them, are providing low-dose CT scans and ICDs without the required shared decision-making. And that's a very serious thing because it's Medicare fraud. And the U.S. government, the Department of Justice, enforces that. So, for example, with ICD, when you provide an ICD without satisfying the other coverage requirements, you can be fined a lot of money. And the Department of Justice has fined more than $250 million for that in the past. And some doctors have even gone to jail. But there have been no penalties imposed for violating the shared decision-making rules. Third, not only is there no enforcement, but things are actually moving in the opposite direction. With respect to low-dose CT scans, Medicare updated the rules just a few weeks ago, basically weakening those requirements, lowering the bar. And finally, some are pushing Medicare to go beyond that and just drop the requirement for shared decision-making altogether. So, in conclusion, right, we heard last month that there were a lot of canceled flights in the UK, so a lot of people were stranded, left at the airport, waiting to take off. Well, with respect to shared decision-making and patient decision aids, we're also waiting to take off. In the United States, we have moved from guidelines to incentives, but now we must enforce those incentives. Dawn Stacy, Angela Coulter talk about sticks, right? Using a stick. We have the sticks in the United States. It's time to start using them. Thank you.